And so I think it's important that you understand the clinical trial process. I'm not saying that the pill is bad. I just want you to think about how to make health decisions for yourself. You want to be especially vigilant, especially staying on top of it. Once I got the information I needed, I started to move in that direction about how to make health decisions for yourself.
In your mind, what would you say to brothers that's not vaccinated or just people in general?
I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do. Hey, welcome to Keeping It 100. We have these real honest conversations to make sure you have all the information you need to make good health decisions. I'm your host, Dr. Kristin Motley. And of course, we have a good show in store for you today. Now, today's show is a little different because we're not live. We had to record because I have a training during our regular show time, but we still going to keep it tight for y'all. So if you have questions, just throw them in the chat. Dr. Thomas is not here with us, but we are going to take a look at the chat over the next few days and make sure that your questions get answered. So just hold tight. Let me bring in my amazing street practitioner co-host, Dr. George.
Hey, what's going on, Doc? How we doing?
Georgie.
Wow.
How you doing?
We're good. I'm good. I'm not going to complain.
That's a good thing. Listen, we was busy yesterday.
Yeah.
Yesterday was MLK Day, and I'm trying to figure out why I was working so hard.
Right, and that's what some brothers said. Y'all ain't supposed to be working that hard. Like this is Martin Luther King Day. Y'all not supposed. I'm like, no, it's about service, brother. We just it's a way to give back to the community and help others that might need some resources and assistance and bringing unity together. So
you're right. Because I was about to give up on MLK Day. I'm like, look, I need to be off. Everybody else off. Why I'm working so hard? But you're right. It ain't about me. It's about remembering and honoring his legacy. So
pretty much.
I can't give up on it yet. I still got to put in my time. I got to put in my time.
Definitely, Doc. And I mean, you're just doing your thing out there. That's your element anyway. So
my element is sitting in the house doing nothing. I don't know
Doc,
how I end up in all these
crazy
situations.
if you ain't have nothing to do. So we're not going to do that.
All right. So we did have a vaccine clinic yesterday. Jude, thanks for coming out and for doing doing your thing and getting the word out. We did about 34 vaccines between COVID.
Really?
Shout out to Miss Simpkins for having us. We have a quick video of her addressing the crowd.
No record of who's buried there.
So we had a good turnout. G and Francis and Thomas held it down for the health educated crew. Shout out to my pharmacy students from the Philadelphia College of Pharmacy. We had about 15 students that came out, and I needed every last one of them. They all were busy the entire time. I had them stay longer. I was like, I don't know if y'all got class or not, but I need y'all to stay for like an extra 45 minutes just to get the rest of this work done. One important thing that they did for me was they updated the COVID test. So a lot of people been throwing out their COVID tests because of the expiration date on the box. But what people don't realize is that's not the true expiration date. The date on the box, what was printed on is what was printed on there is what needed to be on there to get those tests out the doors and in our homes, because we needed to be testing at home to see if we had COVID. So if we did, we can stay our behinds at home. So they didn't have a year or two to see how long was this test going to last. They need to get the test out the doors. But now, since time has passed, since those tests have been manufactured, that the time has passed enough for the FDA and the companies that create the test to know if it's still good or not. So if you go to the FDA website, you get a new expiration date. And so I had the students update all about 2,000 home tests with the new expiration date so people can stop throwing away tests. So all the tests that we're handing out now have the new expiration dates on them. So shout out to the students that came and helped with registration and answer people's questions. I gave them a lesson on Tuskegee experiment so that they could understand why Black people are hesitant about getting the COVID vaccines, because a lot of them didn't know. Now they know. And now they can understand why and have more thoughtful and empathetic conversations with people.
Wow. Good stuff.
Yeah.
Good stuff, Doc. Good stuff, man.
I got you covered. So nobody, don't throw your test out. Go to the FDA website, put the name of the test in, put the lot number in, and check the new expiration date before you throw out your test. Next, I want to talk about our event that's coming up. We got a big event coming up, an ice skating event at Harrah's. That one is going to be Thursday, February 2nd from 6 to 8. We're going to have a good time. Family night out. We are trying to promote family time in our community. So whatever the family consists of, if it's the mom and the kids, or the dad and the kids, or the mom and the dad and the kids, or the grandma or the aunt, or whoever it is that is the family, bring everybody out. Let's have a good time. We're going to have a DJ, a photo booth. I'm trying to secure some sponsors so we can get some food, but we'll see how that goes. I'm definitely going to give away a bike. That's definitely going to happen. So somebody going to leave with a bike that night.
Wow.
And we're going to give away some other health related giveaways because we want our community to be healthy. And biking is a really good exercise. You don't got to bike all day long. You don't got to, go up to the mountaintop on it. But a couple blocks around the corner. And
why not? Yeah.
You can share some calories. When's the last time you rode a bike, G?
Oh, wow. Wow. It's wild. And it's crazy because I wanted to go biking like last summer because my buddy, him and his wife, they started going biking. I'm like, oh, that's nice.
Yeah.
But I never did. The bikes were so expensive. I'm like, all right, I'm going to just get my steps around the track.
Yeah. I would do my free steps.
Yeah.
I would get my free steps in.
Yeah, that's it.
Funny. Nah, that's cool. But yeah, so I hadn't gotten on the bike in a while either. It's probably been about 4 or 5 years. And Bilal, Bria, Noah, and I went up to the track, and the kids had their bikes, and me and Bilal walked. But it was nice. Right. And then I hopped on Bria's bike for a little bit, and I was like, "Oh snap, this is not bad." So I want a bike too. So I'm going to get me a bike.
Yeah, we might host a biking event this summer.
Let's do a bike thing.
A biking event. Let's come up with it. I'll come up with the ideas, and then I leave all the work to you. But it's okay.
I forgot about that. I don't even know why I even agreed on live TV to do anything.
Right.
Before I told you what you gonna do to make it happen.
We're gonna be on ESPN that day. Hey, Bray.
I'm getting bombed over here. All right, so let's move on over to news. So y'all check out our event. If you can't scan the QR code, we'll put the link in the chat so you can go on and register. We want people to register in advance because we want to know how much food and what all we need to bring to accommodate everybody. And we have to give the county numbers too. So shout out to Delaware County for hosting and for paying for everyone to come out and go skating, for sponsoring this event. We appreciate you, Delaware County. So let's hop on over to the news. I want to remind people that the government is giving free COVID tests away again. So if you don't have insurance, you can go to covidtest.gov, or if you do have insurance, you can go to covidtests.gov. I'll put that in the chat too, or you can call 1-800-232-0233 if you need COVID tests. Also, the government did agree to extend this COVID public health emergency to April. So a lot of us were thinking that it was going to end, and people that don't have insurance can't get a free vaccine, can't get tested, can't get treatment for COVID because the government wasn't going to pay for it at least until April. So everybody's covered at least until April, and then we'll have to see what happens after that. And I think that was a good call, especially since cases are up after the holidays and, with the weather getting cold. So that's good. Oh, gee, you was in the paper. You was in WH about what we got next week. Next week we're going to do. I forgot about it. So
we could get some excerpts or something from,
Yeah, we're going to do that. We're going to pull something up. G was highlighted in an article on WHYY about this very issue in terms of the government stopping COVID funding. And I had a little part in the article. I was like, I know someone who would be good for this article. And G just like blew it out the park. He got all kind of pictures, all plastered over the article.
Came out here, did a photo shoot at the house. I felt like a star at the.
You did really, really good. So thanks for contributing to that story.
Thank you for the invitation. It was a great experience. And it's a great partner for, some of our future things that we want to do. And it was fun. I wasn't even nervous.
Of course it was. And I was like, I got the perfect person. He loves to talk and he got
Yeah.
a lot to say.
Oh yeah, all the time. Yeah.
So good job on that. One
Thank
thing that popped up in the news this week was that gas stoves are not as safe as I guess we thought they were. There's a new study that found out that 1 in 8 childhood asthma cases are caused by gas stoves in the home. And the U.S. Consumer Product Safety Commission is looking into banning gas stoves.
Wow.
Now, you already know this is about to be a whole nother health issue turned political issue, but we'll kind of see how that plays out. But when I was reading about this, it says that when the stoves are on, they push out certain chemicals like nitrous oxide and nitrogen dioxide, and those really are irritating to the lungs, and that's what's causing the kids to end up having like asthma. There's a lot of other chemicals that are released as well, and they are as bad as the smoke that comes out of cigarettes, like benzenes. And so it's crazy reading this. Like, we grew up with gas stoves in our homes.
Right.
Like, that's all we knew, a lot of us. And so it's crazy to realize that it's been, the pollution that we talk about outside is actually inside our homes as well. It blew my mind. I don't know, G, what you think about this?
Wow. Yeah, that's a tough one. It just blows my mind how long it takes them to find out these things.
I know.
I mean, we fed generations and generations of our families off of gas stoves. Can you imagine? First of all, I'm not a big fan of the electric stove because you can't control your heat as far as when you're cooking and certain things. And just to find out that like some of the fumes are toxic enough to create asthma. And, asthma basically is kind of like a major thing in our communities.
It is.
Like from family to family, somebody has asthma. So you want to think, is it contributed by the gas stoves, or this is just something else for us to just have a Facebook topic about? So
listen, it is a real thing. And I think that part of why it takes long to, why it takes so long for this information to come out is because nobody's looking at it. Right. Because you're not really thinking about it. But then when, you start to learn different things about chemicals and what they're doing, and probably somebody was like, when gas burns, it emits these, type of fumes. And then they probably was like, let's look at tens of thousands of homes that have gas stoves. How many, what are the health conditions that these people have that have gas stoves in their homes? And then they pull the data. And one of the pieces that came out of it is like 1 in 8 children who have asthma, it's linked to them having that stove in their house. And then that just starts something, and then we just have to see how the government responds and how that all plays out. But in the meantime, what they were suggesting is that you can turn on the fan on your stove while you're cooking. And what that do is it pushes it out. So it's not helping the atmosphere, but at least it's not in your direct vicinity and you're not breathing it in directly. It's not good for the environment, but that, if you want it out of your face, then you turn on that fan and get it out. Or you can open up a window to do the same thing. And then one of the articles said to put a fan in the window and blow the air out. Who's gonna do all that? I'm not doing. I don't even.
No, we're not doing it because we ain't been doing all that.
So we just go like what we supposed to do.
And what we supposed to do? Throw the stove out?
Listen, I don't know.
And what they're gonna do? Stop all the stoves from Best Buy and all these other places we can buy stoves from.
They might have to.
Home Depot,
at some point,
all these places. Just think about every place you can buy a stove from. So they're gonna recall all those stoves. Then it's gonna be a lawyer talking about if you had a gas stove since 1949 or something, you know what I'm talking about?
I know. I don't know what they're going to do, but the information is out there. We can act accordingly. I'm probably going to turn on the fan when I cook and maybe crack the window. I don't know. That's the best I can do. I'm not putting the fan in the window though.
Right.
I don't even got no fan to put in the window.
And it's winter time. So what you doing?
Exactly. Now I'm wasting my heat and y'all running up my light bill, fooling with this stove. That's about to kill me. Which one do I want?
Right.
Oh gosh. All right. It's too much. Also wanted to mention, watch out for misinformation, y'all. I was reading something that some Trumpsters, some pro-Trump people are pushing out that the Damar Hamlin heart issue came from him getting a COVID vaccine. We know that is not true. So just be conscious of where you're getting your information from. Just because you see it on Facebook or Instagram doesn't make it true. Just be careful. It's just a lot of people that just don't want us to be great.
Right.
I'm very grateful that he's been recovering from his condition. I was really glad to hear all that news, but please be careful, y'all.
Right. And for those that don't know, Damar Hamlin, he's the player from the Buffalo Bills that collapsed on the football field about a week ago. And it came from what, heart complications, Doc?
Yeah, so because of the way he got hit in his chest and the timing of that.
Okay.
Yeah, he was in the ICU for a little bit, but he came out, and I've the last I heard is that he's been recovering well.
Yeah, I think he's home now.
Oh, good.
I think he even rejoined the team this week.
Oh, wow. All right, good.
I mean, he's definitely on the way to recovery, but
that's good.
Yeah, the false information, we definitely got to be aware of that.
Yeah, please be aware of that. All right, let's bring in our guest, Coach. Coach is here.
Oh,
Coach
man.
Charles Thompson. He is no stranger to the show. He was on before in the man cave when I was on vacation or something. But for those of you who do not know him, he is the award-winning director and coach for the Chester Panthers Youth Football League. He's also the founder of Panther Community Foundation. Welcome back, Coach.
How you doing? Chris? What's up, George?
Hey, good morning. Good morning, Coach. You know, that name is stuck with you for life, man. Coach, mentor, icon.
Icon.
We can run your name, man. You're responsible for a lot of young men just turning their lives into something positive. And you just the face of Chester sports and youth leagues. And I mean, wow, man. Like every time I talk to you, I get chills. So
stop, man.
Good to have you, man. I'm serious, man. You always come through for us. And you know, a lot of things, people that you're doing for folks and kids, man, a lot of people don't even see it, bro. You know what I mean? They just hear about your awards, but they don't know the blood, sweat, and tears behind the scenes all these years, man. So just flowers to you today, good brother.
Thanks, man. I appreciate it.
Yeah.
No, thank God, man. I thank God for just sustaining me and giving me energy, man. I've been at this helm for over 20 years now.
Wow.
That's a long time.
Wow. Yeah, man. And this generation, man, we all praying for you, brother.
That's like double time. That's like going 50 years.
Right. Because now I'm with you in the trenches. I know exactly what you're going through with these young kids right now. But it's fine, brother. We're going to be all right.
No doubt.
So we were talking last week. I think you asked me to call you about something, and we ended up talking about this, and you was just talking. I was just listening. I was like, wow, this is crazy. And it really blew me away. And so once we hung up, I just like processed what you shared with me. And then I called you back and you was like, I should have never told you nothing. I was like, can you come on the show and share your testimony? Because I know it will bless somebody and it will change their life. I think they need to hear this. And you was like, I should have never told you nothing. So here we are today.
I know it's crazy, right? You know, George, I was really calling her for something for my son, medical-wise. He is thinking about going to school for radiology. Right. So, you know, I started reaching out to nationally black, you know, people in the professions or in the, you know, in the medical professions. And then she asked the question. She said, so how are you doing?
Oh, wow. That's it. You started getting it, right? That was the exam. You didn't even know. That was the exam.
I was taught coming up, like, don't lie to your parents, don't lie to your doctor, don't lie to your lawyer, right?
Right.
So when she asked me, and I know that the kind of person she is, and I know she really cares about help for the community, period, not just myself, I had to tell her the truth.
Right. Well, I'm glad you did, brother. But that's how she set me up all the time, man. It's all right. It's all right. It means she cared though. She just coming from a good place.
Sure.
She really wanted God's children, and that's it, brother. That's it. Right.
That's all. So when we started, so you started off by saying you had been really thirsty and using the bathroom because you was like drinking all the time. So like start there. We're gonna start right there.
All right. So I went to Florida with our program for the national tournament, December 1st, or somewhere around that time. And 2 weeks before that, I would say 2.5 weeks to almost 3 weeks before that, like I'd been like thirsty all the time. My energy level was kind of low, but I was thirsty, and more particularly at night, I was actually drinking close to a gallon of water at night, getting up and using the bathroom all through the night, right? In early morning. So I didn't really pay attention to it. Like, it's just like, all right, I'm just dehydrated. You know what I'm saying? Like, but I'm not asking myself why I'm dehydrated. So I get down to Florida, with the team. We get down there. We go to the first game, which was on a Sunday. And, I was out there in the sun and everything. And I really felt like, something's going on, but not, I'm not sure what. So I kind of chilled out for the rest of the week, next couple of days. And then one of my coaches and the team moms that were down there, like, yo, you not yourself. We had, a night, like one of the nights down there that, we had all the grown-ups out and everybody was partaking into the cocktails. And I just didn't, you know what I'm saying? Like, I didn't feel right. And so that was one thing that, people, it's like, yo, you not going to party with us? I'm like, nah, I don't feel right. So I just kind of just hung out and just rested for the most part. And the Wednesday we were down there, I just was, again, kind of sluggish, just not feeling myself. Just, I'm thinking it must be this Florida water. It's these ice cubes. It's everything.
It's the Florida water.
I mean, Florida water is terrible. So, I mean, it's like, I wasn't sure. I just wasn't sure. So I was like, all right. So one of the coaches was like, bro, you got to go get yourself checked out. I'm like, all right, man. So right outside the villas where we stayed at Champion Gate. Champion Gate has a urgent care / emergency room right there next to the villas. So I went there. And, they did the normal stuff. They took my pressure. My pressure was fine. And the lady took my blood, pricked my finger to test my sugar. And then she just like looked at me like, and she was astounded. She was like, oh my God. I'm like, what's wrong? She was like, your sugar level was over 700.
Wow.
I know, right? So that's like really walk-in coma. You could have passed out, could have had a stroke, and I'm all the way down there, you know what I'm saying? And so they admitted me to a hospital, and I immediately went on insulin through my IV. I was always diagnosed pre-diabetic, but I just always, paid attention to what I was doing,
right?
And I never had to take insulin ever in my life. Never took any type of diabetic medicine in my life. So they put me in ICU, put me on insulin drip. And the next day I got out of ICU and I was basically getting shots of insulin. And I was there for 4 days, until they got my levels down to where they said it was, that I wouldn't pass out on the airplane.
Wow.
The whole time I was in there, of course, they, to give you all these pamphlets. And then I'm sitting in the hospital, so I really don't have nothing but time to do but read, which I don't even like to read, but I just read it, because I just basically had the time and I just wanted to inform myself of, what was going on, what takes place in diabetes, what type of diabetes. Like I'm type 2, type 1 is when your body can't produce the insulin.
Okay.
Right.
Dr. Thompson,
Okay.
you gotta know something about
diabetes. But most of us are type 2. Where it's just, it's weight, it's habit, it's more diet than anything.
Right.
That, you know, basically could set you in a fit and set me in a spike like that.
Mm.
Thank you, thank you,
Wow.
thank you for
Wow.
sharing. So it's a few of the things that I want to point out from your story. I want to go back to when you said you were feeling really thirsty, like you couldn't quench your thirst and you were urinating a lot. And so those are like key signs of high
Yeah.
sugar. High sugar. It is I'm hungry, I can't eat enough, I can't drink enough because I'm so thirsty. The blurred vision. I think you left that out of the story.
Right. So the night before I went to the hospital, we went to Walmart to grab a couple things. And when we pulled up to the Walmart, I couldn't read the Walmart sign. So that I could not read Walmart on the sign at night. It was just a total blur. And that's when I was like, yeah, let me get this thing checked out.
So those are like the key signs of having high sugar. It's the urinating, it's the thirst, it's the hunger, it's the blurred vision. You could have a headache or feel extra tired. How was your energy level?
My energy level was terrible.
Yeah, because you didn't want to go hang out. Yeah.
Right. And I didn't want to do a whole lot of anything. And it's crazy because, you know, at home, like I got your children, responsibility. So you just got to keep pushing, like no matter. And that's a big mistake. But you just got to keep pushing. Down there, I didn't have to do nothing. So I really had the luxury. Oh, y'all going to the games? Oh, I'm going to fall back. I'm going to sleep. So I did more sleeping than anything. I'm self-diagnosing myself. I'm like, I'm tired. I needed the rest. But no, I was sick.
Wow.
Yeah. And not even knowing it.
Well, I'm glad that you went and got checked out while you were there. I think that's a big deal. I'm glad that they made sure you were stable before they sent you back home on a plane. Sure. How have you been feeling since?
Oh man! So when I was in the hospital, and the staff was, I'm telling you, unbelievable. I just couldn't believe it, how nice and sweet everyone was down there.
It was in the South. It was in the South.
Yeah, it's different. It's way different. It's way different. But you know, they were the nurses and everything were educating me and talking to me and stuff. And then they saw I had one of my program bags with our logos on there and stuff. They were asking me questions and they were coming from the standpoint like, you got a lot of responsibility. You got children, you got a program, you working with the kids and the youth. No, you need to be here. And I really just started educating myself. So they were giving me, even though I was on insulin, they were giving me like orange juice in the morning. They were giving me gelatin for with my lunch, with my meals. And the nurse said, the nurse said, you trying to get home, right? I said, yeah. She said, well, you shouldn't drink this. She said, just tell them to give you just water. So on December 10th, I absolutely cut sweets out of my life, like forever. And
wow.
Well, so far so good.
Right.
Yeah. One day at a time. It's one day at a time.
I started drinking water, lemon water, and I changed, from reading those pamphlets and everything. I started eating things different, like calorie counting, like eating more vegetables. I'm eating if I have an omelet one morning, I might have a English muffin the next, salads during the day, veggies.
Oh, you killing it in these healthy eating streets.
Yes. And I'm telling you, it's crazy. I only ate apples and oranges as a kid. Never really was crazy about strawberries and none of that kind of stuff. And then when I was in a hospital, I just started eating them. I started, okay, all right, this blueberry doesn't taste that bad. And started changing just things that I eat and try to eat more things. I spend more time in Produce Junction now, than I do a lot of other places. Keep going back, getting fresh spring mix, every 3 days. Just, you don't want it to wither and stuff like wilter or whatever it's called, stuff like that. So I just knew that I had to change. I would FaceTime with one of my kids and the look on their face while I was in the hospital. I was just I think I was more scared for them than I was just because I was in the hospital.
Right.
I look again. Then I started, I started working out. I started going to a gym, boxing gym with Johnny Slow.
Nice.
How you feel about going when you first went?
So it hurt, and I'm gonna tell you why. So 2019, like I never posted this or nothing like that, but I was in a severe car accident on 291. Somebody ran a stop sign and hit me head on.
Oh,
I was actually in an SUV. They were in a Ford Fiesta, spun me around. They had to come and pry the door open and get me out the car.
Oh, wow.
And I had severe damage to my left shoulder, my lower back, and my right knee. And prior to that, I had broken my left knee. So now I got 2 banged up knees and a bad back and a bad shoulder. The day I got to that car accident, I was walking 2 miles a day, walking down from my house to the waterfront and back, which was 2 miles, and going to that same gym. Like I was working out, doing some light lifting. After I walked, hitting the bags, doing 3-minute rounds. Like I was actually feeling real good about myself physically. And then once the accident hit, it just knocked me down, killed my mobility. I stopped coaching. I really couldn't stand on the sideline no more to kind of finish the season. And, it just, from the lack of mobility, I gained weight.
All right.
You know what I'm saying? So coming into I'm in week 5 now. So going back to week 1, I went for 3 weeks at 2 days a week. And it hurt. Like it hurts now. I was walking for 6 minutes the first day because my back pain is excruciating. But now I'm up to a mile.
Wow.
In the morning, and it, like I said, it hurts. This venture to work out would be a lot more easier. But when I was in that hospital, I promised myself that I was going to do the things that I need to do to get better. Since December 10th, I think I lost a little over 20 pounds.
Wow.
Wow, that's awesome.
Nice.
It's more though of getting back physically. Like it's tough. I mean, we older. When we turn 50, I've talked to 100 doctors between now and then, December 10th and today. When we turn 50, stuff just different. Like this is in my life now, and this ain't got nothing to do with no sugar or nothing, but these reading glasses.
Right.
I was sitting at my computer squinting. My sister said, "Here," and I put these reading glasses on, and I've been struggling reading even my phone for the last 2 years. Like it was just getting worse and worse. So it's when we turn 50, we really need to start making sure that we get some people in our life that we might not have had in our lives. Like we need a cardiologist in our life. Like one thing all my life, I always went to the doctors and I always got blood work every 6 months. I've always done that. So I never had like the high cholesterol. I never had, the diabetic problem, but it's in my family though. Like my father's diabetic, my mother's diabetic. So, when we have those people in our families, like we need to, if our parents had these things, we need to be conscious of it. We need to find out. We need to know what an endocrinologist is. I couldn't even pronounce it when I first met my first one.
Look at you now.
But
spelling it backwards.
You need to have a cardiologist. We need, we just need to definitely, especially the men. Like we need to stay on top of things. Your doctor give you a checklist of everything that you really need to start doing. So I mean, like it's just I'm just not playing. Like I know the devil tried to. He always trying. Yeah. He always trying. But,
yeah, he waiting. He be waiting.
No chill. He has no chill.
But I'm always sustained. God has always sustained me. So.
Amen to that. Did you have your eyes examined recently?
Yes.
Like you need an eye exam.
No, I do not. Well, listen. So I'm telling you, all my life I had like eyes like a hawk, right? I've always had. I mean, what's it like? My vision was 15 or something like that, 10 or up in the 10s too. Like most people have 20/20. I think mine was like something 15 or something 10 or something like that. So I was worried, because I'm thinking that this was all part of the diabetes. And my eyesight was not. I just had an eye exam last week. My eyes were not affected by diabetes, and that's key because it can. So and basically, I need reading glasses because I'm 50 now.
Okay.
And the doctor told me that I see better than 90% of the people in my age group.
That's good. All right, well, that's a relief. That's one less thing you have to worry about.
Right.
Very, very good. Now, what about your medication regimen?
Oh God, man. Listen, I went from taking amlodipine and bicyprol for my blood pressure to now I'm on, oh my goodness, I'm on Lantus, I'm on that's the pen. I'm on straight insulin. I'm on metformin. And because I told my cardiologist that I'm going back to gym, he put me on Losartan, he put me on something else. And my goal is, so somebody asked me last week, what's my weight goal? And I just told them healthy. Like I don't want to I don't want to be on no medication.
Yeah.
So like that's the goal. Now what I will say is I went to my endocrinologist a week ago, I believe. I go back in like 3 weeks. So when I came home that Tuesday, God got me an endocrinologist appointment that Thursday.
That's hard to do.
I know.
That's like impossible. Like you wait months.
This is how I know. This is how I know I'm favored. And I went to the endocrinologist, and first thing that she did was she said, well, my levels was down, put me on a Libre patch, so I can monitor my levels. And the first thing she said was, we're going to lower your dosages because like your levels have been sustaining. So I went back again last week, and she cut them almost in half. And it's crazy now because now that I've been a month in, kind of eating right, like not eating no sweets and things of that nature. My levels are actually, I don't know if you'll be able to see it, but you can go on here, press this app. My levels are actually super low, but like you can't see it, but it's at 97 right now.
Wow, that's great.
So, but different times during the course of the night, I'm awakened by the alarm as it goes down to 69 and 70. So I know that they're going to be decreasing more of the insulin.
That's good.
So I should be off of it completely, but that was a life change, man. Now, I got to get up, stick myself. You know what I'm saying? I never had to do nothing like that, but I got used to it. Just doing the thing, running this courses and taking the things necessary that I have to do to get where I am. So my goal is to not take any medication at all. So whatever weight that is, everybody has a tolerable weight. Like George, mine might be different from yours.
Right.
But everybody has a weight where your body wants you to be at. And if you're not there, it's going to tell you.
Yeah.
It's going to start making other pieces of your body work harder, your liver, your kidneys, your heart. So I never even understood what high blood pressure meant and what it's really doing, why you have to be on medication to slow that heart down, because when you have high blood pressure, your heart has to pump harder in your body and with any muscle, like even when you go to the gym. So now your heart is a muscle. Now it's working harder. Now it's getting bigger. Right. In the same cavity. So that's why they lower your pressure. So that, it's just, I'm telling you, you got to educate yourself.
You've been reading.
Right. Wow.
Come on, Coach.
Hey, man, come on, co-host with us, Doc.
That's good.
Wow.
It's so important, and I'm glad that you're sharing that you're learning about this, because sometimes people get hit with a diagnosis and won't look into it. They just completely depend on the doctors to make all the decisions, and that's not good. Like, you want to know for yourself so you know what questions to ask, and if you need to challenge something that they're saying. And if you don't know about it, you can't ask those questions. So I love that you are taking the time and taking it so serious to read about all this information yourself. And it sounds like you've been getting some good information. I don't know what you're reading, but it sounds like you've been getting some good information. And I want to caution people that just because it's on the internet doesn't mean it's true. So make sure you are getting quality information from reputable sources, places that you can trust. If you're not sure where to go, you can reach out to us, check with your doctor, but don't just read and believe anything that's on the internet or that's printed, because people just messy. All right, Coach, I got a question for you. Did you get the COVID booster?
Come on, here you go. No, I have not. I haven't gotten it.
It's not too late. It's not too late. Like, when did you last have your shot?
You know, what's crazy?
That last fall?
I don't know. I got
fall
it right
2021.
Somewhere around there.
She go ahead and pull right up.
I'm about to pull your records up right now.
11/21. She right. 11/21.
I remember talking to you about it around that time. So, have you had COVID since then?
No.
All right. Well, you do for your booster. So make sure you carve out some time to get the new booster and
yes, ma'am.
Keep your protection protected, because people that have diseases like diabetes, because your blood sugar levels have been good, it sounds like, but particularly people that have high sugar levels, your blood sugar is high, and that reduces your body's ability to fight off any kind of infection. And so that's why people that have diabetes have a worse time when they get COVID. So make sure you get your new booster, please. The other thing is that long COVID is another thing that has come up. People that have COVID that have new symptoms or new problems that last for weeks or months. That's a whole thing. And so people are having heart issues and lung issues that don't resolve once COVID resolves. Like, that may stay around for like a week or two, but then they're having like long-standing heart issues and lung issues, brain fog, confusion, like all these other things that are happening because of this COVID infection. And what the studies have shown is that people that have been vaccinated have a less risk of having long COVID. So the COVID vaccine helps to prevent long COVID and all that as well. So we want to make sure people know the vaccine is working. It still works. And if you haven't been vaccinated, it's not too late. If you have, make sure you have the latest booster, the one that came out in September that protects against the Omicron variant, because all the new variants that are out now, they're all part of the Omicron family, because Omicron don't wear no protection and it just keep having kids. So that's where we are. Well, thanks for coming on to our show today and being willing to publicly share your testimony. I hope it encourages somebody to do something about their health. I don't care how big or how little, just do something about their health. So thanks so much, Coach.
Thanks for having me. I appreciate you guys, for sure.
And congrats on your award. And again, we'll probably be at the ceremony.
I appreciate that. Thank you.
Yep, congratulations. It's the Ike Jones. What's the name of the award? I can't remember.
Award or
the foundation.
It's the Ike Jones, Ike and Tommy Lee Jones.
Yes. That's going to be a lot of people are getting recognized for all their amazing contributions to the community that evening. Coach, you definitely deserve to be on that list. I'm glad
Coach,
that you're
we need you, man. So let's keep it together.
No doubt, man. I ain't playing with it at all.
I want to remind people that it's important that you stay up to date on your health, because a lot of times we don't find out that we have something going on until we are in the ER, until it's too late for a lot of us. And that stuff is preventable. If you have insurance, pick up the phone, schedule an appointment with your doctor. If you don't have a doctor, ask a friend or family member, who's your doctor? And if they like them, go to them. If you don't have insurance, you can find a community health center in your neighborhood. They're all over. If you're in Chester, if you're near Chester, you can go to Chest Penn. The number to Chest Penn is 610-872-6131. You don't pay anything if you don't have a job. Like, it's all based on your income if you go to a community health clinic. I also put a link in the chat if you're not in Chester and you want to find a health clinic in your neighborhood. But I want us to be serious about prevention and not waiting until we end up in the ER to find out that we have something. Let's like start doing our annual checkups. Now in Coach's situation, he said he was getting his lab work done. So for him, this like slipped in for him to go from being pre-diabetes to like full blown having a sugar so high like that. But he was getting checked out, which is good. If you haven't been to the doctor in the last year, please get your annual physical so you can do what you need to do to take care of yourself.
Yeah.
That's all.
Wow.
That's all I got.
Good stuff, though. Good stuff. Good stuff.
Want to remind you all of our family night out at Harrah's on Thursday, December 2nd. We'll be out there from 6 to 8. Lots of fun, lots of giveaways. Bring the family. Please come out. We are going to see you all next week, Wednesday, 12:15. Check us out right here on cmpradio.net. Thanks for watching.
I'm keeping it 100.
I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do.